welcome to Mental Health Monday. I'm Heidi Gaiman from HeidiGaiman.com. Every Monday at noon Central Standard Time, we meet here to talk about another mental health topic. And right now our series is our mental health road trip. We are advocating for mental health. Last week we busted some mental health myths that were very foolish. And so you can find all those episodes 1 through 4 on our YouTube channel at Heidi Gaiman Writes, youtube.com. Okay, my brain totally blinked right there. So today we're going to do something coming off of those mental health myths. We're going to do treatment, restoration, and hope. So if there is, we said one of our myths was that people will struggle in their mental health struggle their whole lives. And while there is a little bit of truth in that we, will often need to tend to our particular mental health struggles, especially with a diagnosis for our whole lives. Like we might need to consider vitamins, we might need to consider medication, we might need to consider therapy and treatment to keep ourselves in a healthy place. That doesn't mean it'll always look that hard that it often does when we first enter the struggle, or when the struggle just really comes upon us in those really difficult times. So there is hope. We don't always have to have that we don't always have to have that intensity, I guess, of struggle. There is treatment, there's help, and there's hope. And we're going to talk about those things today. God is a restoration God. I think this is such an important theological concept that we don't talk about enough. Like, he does redeem. Jesus Christ died and rose, but he also restores. So he made us at creation. He made our bodies at creation. He brings us into this world, as tiny people, and he creates us. And then even as you go through life, our bodies are kind of falling apart. We can feel the effects, I guess, of brokenness on our bodies and the world around us and our lives and our relationships and all that stuff. Jesus redeems it. There's forgiveness and there's hope in that. But don't forget, he also restores. So God can bring healing, and often he does that in very scientific ways, because God is also the creator of science. He's the one who made all this stuff to work in the universe. And then he also restores in this kind of now and not yet reality that we have. Not kind of, it is a now and not yet reality, that we might experience some healing here. We will experience some level of healing here, but eventually we will have full restoration. Our bodies will be glorified in this, in eternity. Jesus will come back and stand on this earth, and we'll hang out with him. That's a really important fact. And he's going to remake us and the whole world around us. That is, if you want to read more about that, you can read about it in Revelation. Instead of, just getting caught up in the details of all of that typology and metaphors and symbolism, just read it as this gift to know that God restores, and see what happens. So let's talk about real practical things about treatment, restoration, and hope. These are always gifts from God, and we can be grateful for them, but they are part of the world. And so we have to kind of walk out sometimes of our spirituality to enter into these very practical and reasonable things that we use to keep ourselves healthy and well. It's not that they're not touched by God. It's the fact that since we don't find them in our church sometimes, as Christians especially, we avoid them, which is only to our detriment, because that is us separating this idea that God can't work somewhere else. We don't believe in that. So what does treatment look like is the first question. Then we're going to answer the second question, what treatment doesn't look like. Then we'll look at treatment as a journey or a process, and then we'll talk about that restoration and hope piece. Okay, so first section, what treatment does look like, real fast. Number one, it looks like professionals. There is usually in treatment, I don't think it's technically treatment if there's not professionals involved. Otherwise, it's just getting advice from a friend, get support, which is good. And those things are part of treatment, But treatment does involve some professionals. It might involve your family doctor. It might involve like looking for a good psychiatrist, a psychologist to do some evaluations. Therapists of different kind, whether that's a mental health therapist or speech and language pathologist or occupational therapists. There's a lot of resources out there. It doesn't have to look like one way. Like it might look like talk therapy, but there's also other kinds of therapies too. And those should be done by a professional. We're looking for people with certifications. We're looking for people with like initials after their name, not because that makes them like cooler people than us. Like those people shouldn't and don't believe that. If they do, like that's not the mental health or the medical professional for you. But it is because they have had a lot of education in what you're struggling with. Like they know how to help you find what you need to find. And so, it's okay, like look for specialists. We always want to rule out medical things, so like talk to your doctors, don't be afraid to say like, should I see a neurologist? Like, don't be afraid to reach out for what you need, but there should be some professionals involved. The next part of treatment that it does look like is often like medications and vitamins. Doesn't mean you always have to have a medication, it doesn't mean you have to be a vitamin person, but sometimes our bodies, when they're not working the right way, need help for a moment to kind of reset utilizing a medication, or sometimes they might have a struggle with certain chemicals and hormones and things like that, and it might need a medication for the rest of our life. And so that is what we work with those treatment professionals, is figuring that out. We'll talk about later what that kind of looks like in the process and journey section. There's always tools like genetic testing to help you figure out your medication. We can talk about that more in a different Mental Health Monday episode, but know that your body metabolizes medication differently in all people. And so there's such a thing called genetic testing that can help you narrow down which medications are good for your body and the dosage for how you metabolize it. And that can kind of help. There's also like blood work and things like that. Again, these professionals figure it out. Like you can like Google things and WebMD it, but like that's gonna leave you frustrated. So at least do that and see a professional. Also, there's different kinds of therapies, lots of different kinds of therapies. I'm like, I need to move my screen. In case you guys have questions, throw up questions in the comments. And I think I moved it so I can see the comments now. Therapy can come in many, many forms. Like I said, it can be talk therapy, but can also include very little talking. There's a lot of therapies now, like biofeedback and different things, EMDR, that work with, like little electrodes that they put on your brain, or work with tappers I have for EMDR, or different kinds of equipment that help our brains refile and function the way they need to function. Electric shock therapy, they still actually do use that, but that's not what I'm talking about. That might be a treatment that your treatment team considers, but they don't use that very often. So most treatments try to stay pretty non-invasive, as non-invasive as possible, but that means, again, it's going to be a little bit of a process, which we'll talk about in just a minute. Just know that therapy, its goal is to like kind of open a wound a little bit to get the healing done. It can be, a little messy, a little painful in the middle of the therapy. Don't give up. Don't give up. It can be messy trying to find the right therapy and the right therapist to see. Just like a medical doctor, we should be asking, is this person the right person for me? Do I feel comfortable? Do they have, knowledge on the specific kind of struggle that I'm having? You're allowed. Everyone specializes in different things, and so asking ourselves, like, if you have a mental health diagnosis, do they know about this mental health diagnosis, or would there be someone else? Those are good questions to ask. And therapy, we know, is I don't know the exact number, but it is like in the 80s and 90% that we know that the engagement between the therapist and the individual that they're seeing is really what shows us whether it's going to be a good outcome, if we're going to get somewhere in therapy, if we're going to find more and more healing and restoration, in this present day. So know that person, it's okay to pick someone else. That's okay. Support systems and connection are always part of treatment. That's part of what treatment looks like. I like to ask the question, like, who is on your team? You know, who is the team of people that you have built around you to help, and that your professionals are building around you to help? Like, team work is what treatment is all about. And then other supports for yourself. There are like inpatient and outpatient hospital situations for a really difficult, really intense, if you will, mental health struggles. There's also community health resources and things, those resources within our community that we may not need to like have a very intense session, but it'll be spread out over months, that part of treatment. Sometimes those things go together. There's also treatment facilities for addictions and things like that. And then there are alternative meds and medical procedures, acupuncture, participating in some exercise classes, various things like that we would consider. And so that's what treatment does look like. Let's look real briefly. This is going to be a little bit of a long Mental Health Monday, so I'll try to keep it brief. What treatment doesn't look like. It is not one size fits all. It isn't. It's different for everybody, and that's a good thing. If someone's trying to put a one size fit all, thing on you, like a little apparatus, that's not what we believe in treatment, and so you're allowed to ask for something else. Secrets, there shouldn't be secrets in treatment. This is not healthy. I especially see this in family dynamics and family systems. If you are going through treatment, it's okay to have boundaries. Like, you don't have to like spill your stuff to everybody, but you should have that support system that it's not a secret. There's a big difference between keeping intimacy, keeping confidentiality, which your professionals, of course, will do. Even your pastor, as a spiritual professional, will do. But there shouldn't be secrets. There's a difference in that, and maybe that's something we're going to talk about on a different Mental Health Monday. What treatment doesn't look like would be no options. Like, there are always options. If those options are really hard to sort through, that's the work of a social worker or a therapist, even your medical doctors, your team and your family. Ask for help sorting through options, because there should be options. Your insurance might be something else. If you can call the helpline and ask about options. And there's always like crisis lines and things like that are there for those really intense struggles, and they themselves can give you the resources that you need that offer options. Treatment doesn't look like one and done. Like, we're not going to like solve this problem in one office visit. There may be the very, very limited opportunities that happens. And just because it's not done in one doesn't mean that things aren't better in one visit to our doctor, or one visit to a specialist, or one visit to a therapist. But we need to make sure we understand that this is a process, which we'll get to in a minute. The last thing what treatment doesn't look like is a magic pill. Like, there is it's your brain, first of all. Like, it's the organ in our bodies that we probably understand the least about still. As science is doing amazing things, and we understand so much more about our bodies now, and our brains in particular, that doesn't mean that we, have been able to create a magic pill for any mental health issue, nor does it mean that we've, I think that we ever will. Because God is a connector of things, a connector of people, and a connector of everything in the universe. And so I think in that connecting, we weren't intended to just have this magic pill that would make things better. Just don't think that is God's version of restoration. And so if we're looking for that, and we do this in all kinds of different ways, and that's probably a topic for another day. But if we're looking for the magic pill, it's not there. There are pills that help. There is not a magic one. Treatment is a process and a journey. I would give you a heads up that any kind of treatment takes, I recommend about 6 to 18 months, and like looking more toward the 18 months for real, just well-rounded treatment. being able to like work through the process of what our mental health experiences are, what our struggles are, opening up like what's important to us, and getting the right medications takes time even. So it is a journey, it is a process. Don't be discouraged. Don't be discouraged. This is one reason why support is important. We need people around us who can say, I'm still in this with you. I didn't drop off the map. You know, we're going through this together, because it is a process. It is a process. Finding what you need takes time. It takes time, and we're all different, like we said. There's not, you know, there is like some common treatment plans we can use for some different issues, but it's always going to be different for you, and you want that. You want personalized treatment. You don't want someone to kind of like treat you like a factory of mental health struggles. And then lastly, consider the process of restoration that Jesus brings. You know, the fact that his redemption is active in my life now, and he's restoring and healing right now in different ways, but we are also waiting. You know, we're also in that not yet. We're waiting for eternity when restoration is healing. That we can either kind of ignore that fact that restoration is happening now, and we can ignore that it's happening later. But there's so much hope. There's so much hope in knowing that God offers restoration now, and that he offers restoration in the long term. I can't imagine living without the hope that Jesus is going to return and restore all things. Like, I need that in my life. But I also want to know that he hasn't abandoned today. You know, when we read his word, we're assured that he in fact does not. He stays the same yesterday, today, and forever, and it is only in his character to care about now, just as he cares about tomorrow and the next day. Hope, the best acronym I've heard, and I just learned it a couple months ago, but it's so beautiful. Hold on, pain ends. You know, suffering is for a time. Sometimes it's hard to believe. When you're in it, it's like, this will not end. But hold on, pain ends. You know, it's a process. It's a process. That restoration is a process. To everything, there's a season. It does feel like a roller coaster if you've ever seen, like, for grief, how it goes, you know, all over the place. That it is a process, but it's a good one. It's like good work. Good growth comes from this suffering and struggle, and God is in the midst. He's in the midst. You know, he comes to us in those times. Look around you. Look at what you have available to you. You know, look at what God has given us in his word, of course, that hope there, but also look at all the resources around you. Be amazed. Google your struggle online and be amazed. You know, it doesn't mean you have to use all those resources, because some of them probably aren't great, but be amazed by the amount of what is available to you, and I think there's a lot of hope in that when you are looking for some treatment. Wow, the topic of hope is a well that I just think we could all use a little bit of a reminder of in our daily life, but just know that there is hope in the fact that he is working wellness in our lives, that he's working growth in our lives, and that is who he is. If you have any questions, just throw them up in the comments, or you can contact me through the website, HeidiGaiman.com. Remember that this is not therapy. We go to our local professionals for this. This is education, and if I can help with that in any way, just let me know. Mental Health Mondays are every Monday on the Heidi Gaiman Writes Facebook page. Like us and comment and all that good stuff so you can continue to see it. You can also find it on Instagram at 12:30 Central Standard Time, a very shortened snippet. Join us on Snapchat for the mental health question of the day at Heidi Adventures, and you can always find me at HeidiGaiman.com and the Heidi Gaiman Writes YouTube channel. I'll see you next time.